good morning, everybody. And I'd like to thank everyone that has shown me around this facility now that I have watched with amazement and with wonder for the last 10 years, really not knowing what was going to happen with this. And so it's been a pleasure this morning to have a tour as a physician, as I enter these rooms. I can see the forethought that was put in this 10 years ago. I mean, it's amazing to look at a room as you walk in and you see exactly where you're supposed to wash your hands and how you wash your hands and how you keep down infections, and it's just little things like that. The cooling system, all of the things that have been put into this building. It would have been a shame to not utilize this building. And I've seen that firsthand by taking this tour today. And I appreciate that. You know that my #1 issue in running for governor has been putting people to work. You know, Alabama right now is hurting. We have almost 10% unemployment in the state. I think Governor Riley has done an excellent job in Alabama in bringing good industry into Alabama. One of the things, though, that I think we're lacking industries that fill in the gaps when we have recessions that are not as sensitive to those recessions. Healthcare is one of those types of industries. We in the healthcare business know that people are always going to get sick. Not that we want them to, but we want to be here and be available for them as physicians and nurses and administrators and hospital personnel. We want to be here for them when they are sick. And so that is going to happen. And I believe as we fill in the gaps in this state with industries that I believe will create jobs, we need to look at those types of industries. Biotech, the healthcare. That's the type of industries that I want to look at as we look across this state and try to create jobs. As we build buildings like this, if it's approved and the building is built or finished, obviously a lot of it is already built, as you can see. As it is finished, we're going to put people to work in the construction industry. And there are a lot of companies today that are hurting. There are a lot of workers that need work, and we need to put people back to work. And let me tell you one thing that I want to do, and I have promised this. I want Alabama workers and Alabama companies to do Alabama jobs. And I want these guys right here that are from Alabama to do the construction work and to build this beautiful building. These are the guys that I want working here. So I want Alabama workers and Alabama companies to do the work on buildings like this. I look forward to continuing to see this progress. We will watch and see how this process plays out over the next few months. But it would certainly be a shame not to use this facility for what it originally was designed, and that was to take care of sick people. My concern always as a doctor is to take care of patients. And I know that that's y'all's concern, and I just think that we need to have a first-class facility. It would be a pleasure for me as a physician to practice in a facility like this. So I look forward to seeing how it plays out, see how it continues, and I wish everyone the best and hope that we can continue not only to improve the quality of health care here at this facility, but all over Birmingham. We want all hospitals to do well. We want the ones in other parts of the city to do well also. And as a governor, I'm going to try to make sure that that takes place. So I'll be glad to open it up to any questions that you might have.
Dr. Bentley, do you believe that the Certificate of Need Board made the right call okaying this despite the criticism from St. Vincent's and others in Brookwood?
Well, let me say this. I'm going to let that process play out. I have intentionally stayed out of that because I don't want it to become political in any way, and I don't want it to become political from the standpoint of a governor's candidate. That's why I did not come and visit the hospital before the first the CON meeting the first time. I did not want it to appear that I was injecting myself into that decision-making process. And I believe the right decision will be made, and I'm just going to let that decision play out.
Do you believe that this hospital will have a huge economic impact, not only in this county or the region?
Absolutely, I do. And that's the thing that we need to look at. Not only will we have a hospital, we're talking about building other facilities. We're talking about using all this campus here to expand it, to use it for medical meetings, for any type of meetings. I have met over in this facility right here. We've had some of our debates over there. It's a fantastic facility. If we put a new modern hotel over there to house either patients or to house people that will come here for medical conventions, it will be a great economic boon for this area. It certainly will.
Any ideas, be it from the state or elsewhere, about maybe what happens to the old campus or economic development for that section of town?
Well, you know, we need to look at that. And I believe the city is looking at it at the present time. But even as a state, I want to look at that also. I want that area taken care of over in that part of the city. I want to make sure that we have economic development over there. And the facility is designed for a medical facility. It's not as modern as this, obviously, and it's a much older building, but it certainly could be used for that. I believe that we need to look at things like modernization of our mental health from a state standpoint. I want to look at how we can help from a state standpoint use that building, and I'm going to be involved in that.
It's another local issue, but a potential threat to any economic development still remains. Do you think Jefferson County sewer bond deal and that situation? Are they talking about the state being involved a little bit in the sense of creating that some sort of authority overseeing future deals? Do you see the state taking an active part in that situation?
I believe if I, as governor, do not take part in that, it's not going to take place. And I think that it's a critical issue as far as this county is concerned, and I believe that the governor needs to be involved in that, helping to solve that problem. There's no way that you can service the debt that we owe in this county with the amount of money that's coming in. So there has to be some give and take. I personally have said that we need to threaten bankruptcy. We need to bring the people to the table. You can appoint an overseer and pay them $500 an hour or whatever they're paid. But you know what? Unless you bring the people to the table that are involved, you're not going to solve the issue. I think the issue has to be solved, and as governor, I'm going to help this area solve some of their problems, and I'm going to get involved in it.
Do you think there's some talk they think they can get a deal before the new commission comes in November, and that'll be before a new governor, but would you maybe hope that things might be held off and let everybody in fresh faces take a look at the plans and stuff? I would like, and I ask the people in the state to not get involved in contracts, to do things until I get there. If I'm elected governor, I would like to have some input into it, and I think it's only fair for a new administration coming in to have some input. I do. I agree with that. But hopefully they can solve it. Hopefully that as governor I don't have to get involved with it. But there is no way you can service a $3.2 billion debt, if that's what it is right now, with $100 million a year income.